My name's Helen Morgan. I'm an Inpatient Coding Analyst, and I've been here for 41 years. The challenges, coding challenges, the different opportunities you have for advancement, educational opportunities, things of that nature. Positive changes that have continued through all the years I've been here is, one is community participation in activities here at the hospital, supporting the hospital in its growth. Physicians were always available for you to talk to. Upper management, that's always a good one. Friendliness, and always the willingness of upper management to help employees along the way, and having an open door policy to come in and talk with them for whatever concerns you might have. There's a lot of satisfaction in being able to care for the people in the area where you grew up. You feel at home always, no matter what setting you're in. And the people here are precious, and everyone helps everyone. I don't think there's any such thing as being totally alone in this area. There's always somebody to help you, and when you have help, as I did growing up, then you want to give that back to the community in the best way that you can, and I found that the medical field is the best way I can do it. The life-changing experience, really not related to my job, was the fact that 20 plus years ago I had to have a breast biopsy, and rather than the surgeon that did the biopsy waiting for my appointment time to come back in and discuss the issues that were found, he called me to his office personally and to tell me I had breast cancer. And then there were the physicians here I could talk with, and administration, and to find the best management for me and what I desired to have done. And then referrals, physician referrals for what the outcome I expected to have. I'm still here. I believe I was more dedicated, if I could be more dedicated, to patient outcomes. And certainly with the medical background that I had, not just here, but I went into the medical field at 16 years old, initially. With all the education and experiences I had, reading charts, that helped me make a lot of important decisions, and also to be available for anyone that would want to talk to me about that particular diagnosis and the different options they had for treatment, surgical options, medical options, etc. So it did help that way with people out in the community too. Because it wasn't anything that I kept a secret. I let people know so that if they wanted to talk to me and ask me, they could. It would be okay to approach me about it. I enjoy, outside of work, I enjoy being with my grandchildren tremendously. I have adult grandchildren as well as a little 5-year-old grandchild. I have a great grandbaby on the way. Will be born in January. And I enjoy thrift shopping, stores, or junk stores as some people call them. Because when you go into those stores, you can see things that you haven't seen in years. before. You know, just it's like it's a new experience each time you go into a thrift store. Okay, some advice that I would have for younger workers starting in the field is, first of all, education. Continue your education no matter what field you're in. There's a lot of different opportunities in the medical field. There's more now, I think, than there was in the past. It's a great field to be in, and to be able to help people and your patients, be with them, you know, and your community. Commitment. I always come back to commitment because that's what's needed to stay in it. In high school, we had an educational program called the DECA Club, and part of that to gain points for your graduation was they would place you on a job. Other than babysitting, I'd never done really anything, but they placed me at an old hospital that used to be here in Murphy. I was born and raised here in Murphy, Providence Hospital, run by sisters from Massachusetts. And I was first placed in the office, answering the phone, and then into their medical record concept, and then on into the lab. And once I got in the lab, that's where I could really experience a lot of enjoyment, pride. It was a challenge to learn all the different tests, learn about them, what they were for. And from that, I developed an intense interest in medicine and the medical field, whatever concept I was in. One time I thought I might become an RN, but I didn't go that way. I actually wound up in Georgia and went to college and became a medical assistant and worked for OBGYN in Georgia for about 7.5, 8 years till I moved back up here. So that's my degree as a medical assistant. The Erlanger team is very important every day that we work. We work together. There's always somebody that you can help or they can help you. As the team pulls together, our goal is to be the best that we can be, no matter what part of it we have in the system. And when we establish common goals, the result is success. Yeah, it's been quite an experience. And once I got here, I loved it, everybody, everything, all the concepts, and I stayed with it for 41 years. First I thought I'd be here about 30 years and then retire. That didn't happen. Now, 35 years, didn't happen. 40, still here, and looking forward to continuing. To sum up my experience at Erlanger in one word, the word would be commitment. Because of the field that I'm in, the patients, the area, the rural area I'm in, and the help that everyone needs from time to time. Commitment and dedication.